Another question that I hear frequently, especially from the younger practitioners, is that my wife would like to be part of my team and work in the practice simply because when we take a vacation, we'd like to have the same time off. And if she has another job, she isn't able to do that. Is it a good idea to bring my wife into the practice? My team members like her as a person, but I've heard from other colleagues that this is really not a good idea to bring your spouse into your business. How do you feel about this, and what should I consider? Well, the first thing that a doctor or any employer needs to consider is what is this person's job title and what is this person's job description. Because if this is not defined, then it's confusing to not only the spouse, it's confusing to the coworkers, and it's also confusing to patients. The second thing you need to consider is their work commitment. Is this going to be a serious position, or is this going to be a position where the spouse is allowed to come and go and the team members really can't depend on this person to be there in the position that they've been hired to do? And if they don't have special privileges that they can come and go and they are treated as an other team member, I think that it can work out very, very well. But the work commitment has to be there and has to be the same for all employees. And the third thing that I think is very important is, can the doctor and the doctor's spouse separate themselves from being husband and wife during 8 hours a day? Some couples do very well and work well together. And I would say that in my 35 years of consulting, that some of the practices that I've worked with where the spouse is involved, if it were not for that spouse, there wouldn't be a successful practice, because nobody really cares as much about the practice as the family, the spouse. In other practices, it has been a total disaster, and I've actually had to talk to some clients about not having their spouse as part of the team. So a lot depends on their work commitment, their job description, and also their personality. And that is, does their personality blend with the behavioral styles of the doctor and the coworkers? This is a very important part, whether it's a family member or not. So it's a lot is dependent upon who the spouse is and what the couple decides is going to work best for the practice.